my wife has been diagnosed with CIDP,
Sure.
which is chronic inflammatory demyelinating
Polyneuropathy. Sure.
treated with IVIG and gabapentin.
Okay, cool. All right. And what's your question?
She's been on it once a month.
How old is your wife?
Infusion.
Yeah, how old is she?
48.
Okay, and how long has she had this issue?
September, the symptoms started September 2012.
Cool.
Out of the blue.
Has she gained any weight?
No.
All right. Does she have anything else going on like diabetes or thyroid disease?
They checked everything. No, blood sugar's fine. They did a spinal puncture, they did it all.
All right. CIDP is caused by something. It just doesn't happen on its own. Okay. When you end up with these inflammatory polyneuropathies, there's a reason, and very frequently it's autoimmune. All right, exactly. And so this is terribly important. Okay, so you've got a peripheral polyneuropathy, an autoimmune polyneuropathy. Okay, so you're receiving immunoglobulin, which may not exactly be the best way to do it. Okay, so if you try it out and it doesn't get any better, or if you try it out and it gets worse, that tells you something. Okay, it tells you that you're not looking at the cause. All right. Now, there are other things that people have been known to do. You can do plasmapheresis. I don't really find that to be particularly helpful either. But you need to make absolutely certain that your wife doesn't have Addison's disease. All right. Now, Addison. Yeah. What is it? It's adrenal failure, and it happens. Autoimmune adrenal failure, you'll end up with these polyneuropathies like this, and they're focusing on the echo rather than the voice of the beast, if you get my drift. So the answer might be that she needs something more, quote unquote, natural, like cortisol, okay, instead of the prednisone that they nailed her with. Because more than likely, the first thing they did was hammer her with prednisone, okay, which tends to make this problem worse. So if this lady walked through my office, okay, and now you hear the story and you go, yeah, I've seen this before. The first thing I would do would be to draw blood on her, looking for cortisol levels, pregnenolone levels, androstenedione levels, not to mention parathyroid levels, because every once in a while that can enter into it, and insulin levels. To that autoimmune thyroid evaluation is necessary, and then you have a reasonable expectation to figure out what set this thing off, because it's not enough to give somebody a label, gee, you have idiopathic demyelinating polyneuropathy. That's nonsense. Okay, there's a reason. Something's only idiopathic, okay, if the doc can't figure out what the cause is. Idiopathic just simply means cause of uncertain origin. So I prefer to look at this thing as what I would call cryptogenic. Okay, cryptogenic is a term that I started to use almost 35 years ago, which simply means is I don't know what the heck's causing it, but we're going to figure it out. Crypto meaning uncertain and hidden. So, yeah, that's what I would do for you. That's what I suggest that she do. And get back with us. Let us know what they find.